everyone. I'm Dr. Sheila Almeda, a pediatric pulmonologist. I'm going to tell something about diseases of the respiratory tract. So we can avoid these diseases in several manners. So first, of course, it's better to prevention is better than cure. So how can we prevent these diseases? First, of course, it's very important to do hand washing. Okay, avoid close contact with person who has common colds or who has respiratory tract diseases. If you have colds or if you think that you're sick, you just stay at home so that you cannot spread the germs or the virus. If you cough, you always cover your mouth, and if you sneeze, you always cover your mouth and your nose. So second, these diseases can be prevented through vaccines. So it's very important that especially the kids has complete vaccines. So first, I'm going to discuss about the common cold. So we all know that common colds, what are the signs and symptoms? Of course, cough and colds, you can have fever, okay? And these common colds, is usually caused by different viruses, and this usually doesn't have treatment because this is caused by a virus and it would go away on its own. So how do we treat this these kids who has colds? We give nasal decongestant or paracetamol for fever. So second, the influenza. So we have this flu vaccine. It's very important to have flu vaccine annually so that you can prevent the flu disease. So what are the symptoms? It's very similar to common colds. It is associated with high-grade fever, chills, body aches, and this is usually detected through a very special test, which is called the PCR. So how do we treat this? We usually give antipyretics for fever, and then we give antiviral like Tamiflu or oseltamivir. So third, TB. TB is very common in the Philippines, and TB is usually not prevented by a vaccine. But the BCG vaccine, the disseminated TB, which means very severe TB disease, can be prevented through BCG vaccine. So how can you detect TB? Of course, if you have the signs and symptoms include cough for more than 2 weeks, if there's weight loss, if there's loss of appetite. Okay, some may have blood in the sputum, if they expectorate sputum. Some, and it's very important also that these kids who exhibit this disease has exposure to person with TB. Of course, if you have the signs and symptoms, you go to your pediatrician or to your family doctor. So they might request an X-ray, a skin test for TB. So what's the treatment? The treatment is anti-TB drugs, which consists of 3 to 4 different regimens. And it is usually given for 6 months. So it depends on what kind of TB. Okay? So third, pneumonia. So you can also prevent pneumonia through vaccination. So what are the symptoms of pneumonia? Of course, you have high-grade fever, you have cough and colds, you also have difficulty breathing or fast breathing. So if you have these symptoms, you immediately consult your doctor. So what's the treatment? So the treatment for pneumonia is antibiotics. Okay? It depends on the age group of the patient, because there are different bacteria causing pneumonia in different age group.